Oral hypoglycemic agents. Oral hypoglycemic agents are mainly used for the hyperglycemic condition. Hyperglycemic condition in which the blood glucose level increases from the normal value. Diabetes is of mainly two types: diabetic type 1 and type 2. In type 1, only insulin injections, IV injections are available, and for type 2, in which the insulin insufficiency is occur. In this type, oral hypoglycemic agents are given to the patient. In the oral hypoglycemic agents, in this category, sulfonylurea is a main class of oral hypoglycemic drug. Actually, this type of class, it works to stimulate beta cells to produce insulin, and it is divided into four classes. Sulfonylureas are divided into four classes: first generation, second generation, third generation, and fourth generation. In first generation, the main drug which is tolbutamide. In second generation, the main drug is the glipizide, and for the third generation, the main drug is the glimprimide, and for fourth generation is in the clinical trial stage. The mechanism of action of sulfonylurea. The sulfonylurea basically stimulate the secretion of insulin from the beta cells. It help in presence of functional pancreatic beta cell is must, and it inhibit the potassium channels. That's why in the calcium ion channels open. Due to the inhibition of potassium ion channel, the depolarization of membrane occurs. That's why the calcium channel opens. Calcium ion enters the cell and trigger the release of insulin. The increased insulin concentration lowers blood glucose level. Actually, the basic theme is to membrane depolarization, and due to the depolarization of the membrane, the calcium ion channel opens, and when calcium ion channel open, there is increased influx of the calcium ion into the tissues, and that's why the insulin secretion increases, or the sulfonylurea increases the insulin release after binding with the sulfonylurea receptor. This is the main pharmacological action, and the main motto of the class of the drug is to increase the insulin release from the beta cells, and this insulin decrease the increased plasma glucose level, the increased blood glucose level. Thank you. हो गया 5 minutes तो नहीं दे रही। Biguanide. The next category is the biguanides. The main drug for the biguanide is the metformin. The mechanism of action of the biguanides is to activate AMP kinase, and this AMP kinase, when the AMP kinase inactivated, it produces the following pharmacological action. It decreases the hepatic glucose production. It decreases the hepatic glucose production and also decrease the intestinal glucose absorption. And next action is the increase insulin action. Increased insulin action causes to remove or to decrease the increased blood glucose level, and the hepatic glucose production decreases by the biguanides. It is the main pharmacological action of this type of class of drug. And the advantages of the biguanides are the no weight gain, no hypoglycemia, and reduction in the cardiovascular event and mortality. It means the metformin is the most important class of the drug, and recently this drug is prescribed by the doctors. Mostly this is prescribed because of their less side effects, no weight gain and no hypoglycemia, which is the main side effect of all the category of the drug. And the disadvantage or the side effects are the diarrhea, abdominal cramping, lactic acidosis, and vitamin B12 deficiency. The contraindications of the biguanides class of the drug are the reduced kidney function. It means the person which are suffer from the kidney disease, they don't use to reduce kidney. Thank you.